Aloha, and welcome to another episode of Financing the American Dream. I'm your host, Jason C. Scott, and today we're in the beautiful area of Kahala. And today we're going to be interviewing some amazing individuals, two doctors, Dr. Creekmore and Dr. Keefer, and how they are helping our veteran community literally treat their brain. You're going to want to tune into this one. Let's go meet them now, and let's get this show started. All right, we are here with Drs. Keefer and Creekmore at Brain Health Hawaii. Gentlemen, welcome to the show.
Thank you.
Pleasure meeting you. What is your tie to the veteran community, and what made you get into doing this and helping veterans with what you do?
I've been working with brain development, child, adolescent, adult issues for about 2 decades. My father was a Korean Navy veteran.
And then your brother?
My brother.
Also served in the Navy as well, correct?
Yeah.
Combat veteran, one deployment down to Iraq back in, 05, 06 already.
What exactly is it that you guys do?
We utilize some software to help us guide personalized rTMS treatments.
When you've gone through some things that we've gone through, right, and we see this commonly in veterans, a lot of the brain just doesn't work the way that it should. And so that way we can get you in and use the magnet to gently wake those back up to get them functioning back where they should.
There's just a lot of hope and optimism in where this can go because of, previously a lot of these conditions prior to 5 years ago, they were thought to be untreatable. It's definitely part of our vision, make this type of care available to the active and veteran community.
You have to remember that life goes on, whether you've deployed, whether you haven't, and sometimes it's just a struggle. Sometimes there's fears in there, especially when you look at the active duty side. And it's just amazing to bring something like this that's an alternative that could either complement what already is going on, which I've seen a ton of times. Being able to bring this to not only veterans, but also my brothers and sisters who still put on the uniform every day is going to be an amazing thing, and taking it to Colorado is going to be exciting. Yeah.
Folks, you're actually going to get to see them hook me up to the machine and basically explain a little bit to the folks what the treatment is, and they can see in real time. Sound cool?
Yeah.
All right, let's make this happen. Dr. Keefer, go ahead and tell the folks, go ahead and show them how bad my brain was.
Well, this is what we would consider a quantitative EEG or a brain map. And as you can see, the absence of sort of a mound or a kiss here is usually what we see in people who have had a history of TBI or concussions. And we're beginning to see an activation of neuron or brain activity, and gradually in most regions, which is then going to help him feel better, focus better, think better.
So we're going to take the data that we got from the EEG with Jason, and we're going to use that to, Dr. Keefer is going to do this now. We're going to put the paddle right on Jason's head. Very gently, magnetically induced impulse to wake the brain up.
I've come in here taking a nap multiple times, right, during the 18 minutes. You don't feel anything. That just goes to show how safe it is. We keep a minimum 3 hours in between treatments, and seen some massive improvements. All right, folks, that's a wrap for today's episode on Financing the American Dream. But here's the call to action. Who do you know that either A, is suffering from anxiety, PTSD, or even a traumatic brain injury? If you know someone, get them into Brain Health Hawaii. The folks here, the doctors, they will take the care, they will take the time and get them the help that they need. That's it for now. Ahui ho and aloha.